well, this can't be natural, right? This can't, yeah, no, that's not looking healthy.
Yeah.
Do your physician buddies scold you personally for being on TRT, and how do you handle that? I get scolded by my physician buddies.
Who's that from? Where is that at?
Joe 6831.
Oh, I see him. Yeah. Do your physician buddies. Okay. No, I mean, I don't have a lot of physician buddies. Not really, though. I think the more people around here, at least, they kind of ask me questions. They're interested. I mean, at least if they ask, I'll talk about it. But yeah, in general, they don't scold me, but they'll scold my patients. Like some doctors around, some of them will scold them for being on TRT. But it's becoming a lot more accepted now, thank goodness. It seems to be that older generation is I don't want to say dying out, but they're retiring. But there's still a lot of strange beliefs among some practitioners about TRT, and they do. I had one the other day. It was terrible. A guy who'd been started on TRT is diabetic, needs to get his health in order, no doubt. But his nurse practitioner said, "You have to stop TRT because you're diabetic." I was like, "That's the stupidest thing I've ever heard." It's actually opposite of that. So yeah, I just don't care what other people think about me being on TRT or not. I'm very vocal about the benefits. People around here, especially like a lot of the nurse practitioners we've given talks to, they're receptive to it, because it's becoming such a common thing. They have to learn how to deal with it. But there are a lot of docs that still just blow it off. They don't give it the credit that it deserves for being a real issue. I've seen urologists, especially a lot of the private practice urologists, they make jokes about it in their forums and stuff about, what patients want, and they're trying to get dialed in, and they think these patients are just making up symptoms and making things up, and they just push pellets on them or try to get them, pre-authorized for androgel because they want their insurance to cover it. And they say, well, if the insurance doesn't cover it, we're not messing with them. They don't work with people. Most of these people aren't even on TRT, so they don't know the benefits. They don't know how it really works, and it gets frustrating from that standpoint. So I understand patients getting really frustrated with their providers for not knowing what they're doing, because it's rampant. It's everywhere. It's actually embarrassing how bad it is. I think it is probably getting a little better slowly, but it's awful. And it's not just around me, right? It's worldwide. I mean, we hear this stuff. The same stuff is everywhere. Just so, yeah. But nobody's really come at me saying you need to get off your testosterone because blah blah blah. Like, well, I'm healthier than I've ever been in my life, and you're not, but they have misconceptions. I mean, I've talked to doctors about weight loss, and I'll start talking about calorie deficits, and the stuff they start talking, they're still thinking protein's going to hurt their kidneys and all this stuff. So they still labor under just myth, and that's what people don't understand about physicians, especially. They just repeat things they've heard a lot. It's just par for the course. I'm sure Steven can agree. It's just common, right? It's the same thing with TRT and prostate cancer, right? There's still urologists telling people that stuff because they heard it and they were taught that, and they just repeat it. They don't look into it. It's actually worse than people can imagine. So patients need to be their own advocate. I don't give a crap about all the propaganda saying you can't do your own research if you don't have an MD. That's BS. No, research is not just Googling something, but if you actually know how to read papers and interpret them and ask questions. You can ask your provider questions when they start making ridiculous claims about your health and whatever. They say something that doesn't sound right, and you go, "Can you please provide me some backup for that?" And they can't do it. That's a problem, right? You're in the right for asking that. Don't let them bully you. You are your best advocate. You know your health. There's lots of this online now information that we try to back up with actual, as much evidence as we can, because we don't know everything, but people are becoming savvier about this stuff. And so you need to hold your provider's feet to the fire, in my opinion, if they're telling you something that sounds like nonsense. That's for everything, not just TRT.
Yeah. I've been on conferences or in a restaurant with 20, 30 dermatologists. They're all sitting there looking really unhealthy, obese, drinking lots of alcohol. And then they look at me and they say, well, this can't be natural, right? This can't, no, that's not looking healthy.
Yeah, I know. It's unbelievable, but it makes them feel better to be in their little group, and that's just human nature.
Well, they are always way more as unhealthy docs.
Yeah. Yeah, absolutely.